Hi, my name is Stefano Luminari. I'm professor of oncology at the University of Modena and Reggio Emilia. And in this video I will comment about the lecture that I had the opportunity to give about what's new in peripheral T-cell lymphoma as part of the media professor session of the last ICML meeting. The field of research and clinical research in peripheral T-cell lymphomas is rapidly evolving, and we are now living a phase in which we are preparing the research field and our patient to live an era of paradigm change in the management and the approach to this lymphoma patient. We are doing a lot of work about the pathologic assessment, biological definition, and discovering novel targets that can be useful to direct novel therapies. For the time being, the most exciting data comes from the pathologic definition of peripheral T-cell lymphomas that are now approached according to a cell of origin based approach, similar to what is done in diffuse large B-cell lymphomas. We have different types of peripheral T-cell lymphomas with different cell of origin, with the T follicular helper subtypes being the most frequently represented, with approximately 40% of PTCL-NOS coming from that subtype. And we have other subtypes. And what's emerging very clearly from the clinical research is that we need to look at peripheral T-cell lymphoma by different biologic subtypes, because the activity and efficacy of treatment is different from one subtype to the another one. Basically, what we already learned is that brentuximab-based chemotherapy programs are more effective in anaplastic large cell lymphomas, while the novel agents, including epigenetic modifiers, are probably more active in angioimmunoblastic disease coming from the T follicular helper subtypes. And we have additional data that suggests that other class of agents, including lenalidomide, including PI3 kinase inhibitors, are active, but specifically active in one of the specific cell of origin subtype that I discussed before. So we are now actually redefining all the assessment and all the concepts that we have used for a long time for managing and for considering PTCL-NOS patients. And in the future, we should expect big changes in the way we currently look at these diseases. But most important, PTCL are very rare disease. And if we split PTCL into smaller groups, we are facing with even rarer diseases. Thus, to grant for further advances in the management and in knowledge about this peripheral T-cell lymphoma patient, we need strong international cooperation with that is the only way we can apply to define the well-sized group of patients that can show and can demonstrate very clearly the efficacy of novel therapies. Thank you very much for your attention.